Are you suffering from heart disease, recurrent sinus infections, joint pain? Your mouth might be the real problem here. Watch my video to learn exactly what to do to take control of your oral health. Hi everyone, Dr. Sanda here. I wanted to chat a little bit about oral health. You know, so many doctors and even people overlook their oral health. And I have patients that come into our office and ask, well, what can I do about my overall health, my nutrition? I eat organic. I have the best water, alkaline. I work out. But then I look in their mouth and they're not taking care of their mouth. And I really want to stress to you, go ahead and check out my video about a self-oral exam. Go see a biological dentist. Do you have inflammation in the mouth? If you have inflammation, this can go undetected. It doesn't mean that if you have no pain, you have no problems. So what happens if you have inflammation in the mouth? An inflammation can come in the form of gums bleeding or cavities. So if you look at your teeth and you see brown spots, those are also part of inflammation. If you look at your gums and you see the red and you're brushing and flossing and your gums are bleeding, that's inflammation. So perhaps you have gum disease. So gum disease basically has this bacteria underneath the gum. Whenever your gums bleed, bacteria from the mouth gets into your bloodstream and it starts traveling. And yes, our immune system is there to capture bacteria that's traveling in our body, but our immune system is not perfect by any means. So bacteria escapes from the scavenging system of our body, which is the immune system, and it starts lodging in different places. So for example, gum disease bacteria has been found in the heart valves of patients, and we know that inflammation in the mouth increases the risk of heart attacks and strokes. But also bacteria can travel to the joints. So we know that we found higher inflammatory reactions in the joints for people suffering from periodontal disease. Also, people can have an increased risk of lung infections, pneumonia, when you have periodontal disease or gum inflammation. Also, undetected infections like cavitations in the jawbone, which can only be detected usually by 3D CT scans, can actually affect your sinuses, and they could travel from the sinus area to the brain. And that can create brain fog and brain inflammation. That's why it is so important to stay on top of your oral health, because it really affects your overall health. If you're diabetic, for example, make sure your gums are under control, that they're not bleeding, because if they are, it'll make your diabetes worse. Pregnant women should take care of their mouth because everything transfers to the baby. So mercury fillings, for example, transfer to the baby. Periodontal disease predisposes a pregnant woman to give birth early. So it's an extra stress on your body, and it will manifest in other places, even if you don't know it's there. So it's important to get yearly checkup with your dentist. If you have any questions, go ahead and tweet me or visit orasana.com for easy, simple steps on how to overcome some of this inflammation at home. You don't necessarily have to wait for your dentist to help you. Take control of your oral health today. Thank you for watching. My name is Dr. Sanda. Make sure to subscribe below to stay up to date for hot off the press new videos about the microbiome and your overall health.